Top doctors, leading research, cutting-edge diagnosis, powered by the NYU Langone Medical Center. This is Doctor Radio, Sirius and XM.
You're listening to Dr. Carol Bernstein on Doctor Radio, Sirius 114 and XM 119.
I used to rule the world. The season rise when I gave the word. Now in the morning I sleep.
Welcome to all of our listeners out there to Sirius 114 and XM 119. I'm Dr. Carol Bernstein. I'm an associate professor of psychiatry and Associate Dean for Graduate Medical Education here at the NYU School of Medicine. I just want to remind everybody that you can follow us on Twitter and also email us with your questions to docs at sirius-radio.com. But you can also follow us on Twitter with all the latest updates. Now, we have a very, very interesting program set up for you really in this next hour. As you all know, our population is aging, getting older. There's a lot of attention focused on geriatrics as a field generally in medicine, and as the baby boomers move into later life, as we like to say, the talk on the street is that we're going to be doing it differently than people before. Nevertheless, I think there's increasing focus on what happens to folks as they age and as they live in nursing homes. And we're going to hear about a very fascinating new program. Our guest on the phone is Dr. Marilyn Gugliucci, known as Dr. G. She is the Director of Geriatric Education and Research in the Geriatrics Department at the College of Osteopathic Medicine at the University of New England in Biddeford, Maine. And she's the creator of the Learning by Living project. Marilyn is also president of the Association for Gerontology in Higher Education. And in this first segment, we're also going to hear from Vicki Johnson, who's a medical student who participated in the program Learning by Living and lived in a nursing home for 10 days as part of her medical school education. Well, welcome, Marilyn. Delighted to have you here on the show.
It's great to be on. Thank you for the invitation.
Well, you're welcome. I must say I did catch the eye of this since I've been in medical education my entire career, really, and I read about your program in the Times. But why don't you tell our listeners about how you got interested in doing this and what the program's about?
I think I've always been an out-of-the-box thinker, Carol, and that probably helps. But the inception of this program was when I was done teaching first-year medical students in 2005. And after that lecture, I had a medical student come into my office, 23 years old, Rena Joaquim, and had never been around older adults. And she said to me, Dr. G, I want to learn how to speak with institutionalized elders. And it was interesting to me, one, because I never use that term, institutionalized.
That alone speaks to some of the issues,
doesn't
right?
It? You know,
right.
In terms of our society. But I was looking at her and I'm thinking, you know, you would speak to them as you would any adult. And there was something about that thought that I said, you know, this is a teachable moment, and that statement is just not going to do it. So what came out of my mouth, no preconceived notion whatsoever, I just said, well, Rena, would you live in a nursing home for 2 weeks as if you were an elder resident? And she looked at me. She had these huge eyes, and there was this pregnant pause for 30 seconds, and then she said yes. I had no idea if it was even possible, Carol.
Right.
And I just, you know, when she committed, off I went.
And how did that, and how, you know, I am so struck by it because obviously one of the issues that we're all concerned about is how we help our doctors, our student doctors and our doctors learn how to really connect with patients, particularly in this age of automation and testing and concerns that we're losing the nature of the doctor-patient relationship. How did you go about setting up the program? How did you approach the nursing home, the school? I'm just really curious about all of that.
I talked with my boss, the chair of the Department of Geriatric Medicine, which is Dr. Bruce Bates, and He kind of looked at me like I had four heads, because obviously this was a program that we thought had never been done anywhere, and have since found out that we are the first to design and implement this program. And he was kind of looking at me, and he knows me, so he said, well, see what you can find out. And I actually have many friends in the state that are nursing home administrators, and went to one particular gentleman, Steve Marston, up at, he was at a nursing home in Skowhegan, Cedar Ridge Healthcare. And even though that nursing home is a for-profit nursing home, he agreed, and it's a volunteer program. There was no money for his nursing home to take a student on. So at that time, that nursing home was losing about $250 a day to have Rena stay there for 2 weeks, 24/7. So
wow.
Once we got Rena into a nursing home, then I just started talking with other nursing homes, because that first experience was so positive for everybody. A larger group were affected by this program than I had ever even realized. So it just went from there, and I'm not shy. I'm an extrovert. I'm kind of in your face and saying, "What do you think?" And I get really excited about it.
Oh, that's great. How many students participate in these programs now?
Well, right this past summer, I had 3 students go in, and again, as I mentioned, this is all volunteer. We were lucky enough to have the Sam L. Cohen Foundation fund us, and what we do is we give the nursing homes a mere $400, which they use either for a party for their residents, or if there's a piece of equipment that maybe they could use. But other than that, it is volunteer. So we've had 10 students so far. As I mentioned, 3 this past summer, and you can imagine how much, since I'm the only person really supervising this program, and the students can reach me 24 hours a day, it gets pretty interesting. It's pretty intense 2 weeks. So
what do they do? I mean, are they? I assume they're actually admitted as if they were residents of the nursing home, correct?
Actually, one of the things that I felt the reason why this program needed to be in place was, in all the teaching that I do in the medical school, and I was a coach in a former life, and so I know that you need to reach people kinesthetically, auditory, and visually. So, you might use PowerPoint, you might use experiential exercise. Well, medical students really learn well by experience. And so getting them in the nursing home is a way to have them really attain experiential learning. So that was the first part, was saying, okay, how can we get the biggest experience here for the students? The other piece that I'm dealing with, and I'm not answering your question, I'm sorry, but the other thing that's important is that we have this social construction in society that has anybody who is older, once they reach the age of 65, they're viewed as somebody who either, is going to lose their mind if they haven't already, or there's this whole disease decline model. And it was so important for me to have students connect with older adults and find out that those things are not necessarily true, or there's ways to work with older adults regardless of the disease they have or the environment where they're living. You want to ask your question again?
Well, what I was saying was, what do they actually do when they get into the nursing home? I mean, I assume that they're like a resident of the nursing home, actually, that they're not just standing there watching and observing.
Not at all. We do give that option for the student to live there, because what we know is that nursing home staff are incredibly busy. In every case, though, the nursing homes have said, no, we want to give the student a diagnosis. We usually go with chronic obstructive pulmonary disease and congestive heart failure. The students actually get fed, get bathed, eat pureed foods, usually the first 24 hours. They experience what it's like to be in a Hoyer lift. And
a what? A what?
A Hoyer lift. I'm actually going to ask you to ask Kristen about that, if that's okay.
Okay, I'll do that.
She had that experience, and it was a great learning for her as a medical student.
Okay.
And then they're either in a wheelchair or a walker. And many times they might have a nasal cannula, which is that oxygen tube. Sometimes there's an oxygen tank. Sometimes there isn't. The tube might go around their waist and into a pocket. People don't even realize that once they see this tube in their nose that there is no oxygen tank. They're just appalled, that the student is on oxygen at an early age. They are truthful. If they're ever asked by a resident or any of the staff, they say, I am just a student. We're not trying to fool anybody. This is really based on a biographic, their own experience of being in the nursing home.
Right. Well, that's great. Well, I would like to take this opportunity to invite our listeners to call us with their questions and thoughts. Have you had an experience with nursing homes with your loved ones? Are you concerned about the care they're receiving? What do you think of a program that puts medical students actually in nursing homes as patients in terms of helping them become better doctors and more sensitive? Give us a call at 1-877-NYU-DOCS. That's 1-877-698-3627. I'm Dr. Carol Bernstein, an associate professor of psychiatry here at NYU, and I've been talking with Dr. Marilyn Gugliucci, who's the director of Geriatric Education and Research at the College of Osteopathic Medicine at the University of New England in Biddeford, Maine. And she's been talking about this really unique live-in elective program that she has set up for medical students to help them understand more of what it's like for geriatric patients inside a nursing home. And I'd now like to welcome to talk with us Vicki Johnson, who was one of Dr. G's medical students who lived in a nursing home for 10 days as part of the program. Hi, Vicki.
Hi, good morning, Dr. Bernstein.
How are you?
I'm doing very well. How about yourself?
I'm fine. So could you tell us how did you decide to do this? What intrigued you about the program? And then share with us a bit about what your experience was like.
Yes, certainly. I think the first day that I heard about the program, Dr. G had come in and given sort of a lunchtime talk about various programs that were available over the summer, and she had happened to mention this Learning by Living program. And I'll tell you that I was immediately struck by it, and I knew that I wanted to do it. Having decided to become a physician, I feel like I will be in the business of taking care of people and taking care of patients. And whether it's a patient who is in a hospital or an older adult who's living in a nursing home, something has happened to them with their health where they're no longer able to really take care of themselves. And now sort of their care is in the hands of somebody else. And I thought to have that opportunity to have lost the ability to care for myself and have somebody else be responsible for it was just an excellent opportunity and a once-in-a-lifetime chance. So I jumped right at it, and I feel so lucky that she allowed me to do this.
And this was at the end of your first year before your second in the summer?
Correct.
Okay.
I stayed at a nursing home. It was called the Highlands, and it was located in Fitchburg, Massachusetts. I was there for 10 days.
And what was it like? I mean, what were some of the things you experienced? Had you ever been in a nursing home before?
I had been in a nursing home, and I don't have any sort of striking memories of either fear or, nothing really in my memory stands out about going into nursing homes when I was young. Of course, I visited family members in them, and I had an aunt that worked in one, but, no really standout memories for me. But I can remember, the first day, so I drove myself to the nursing home, and I checked myself in. So I walked in the front doors, and I would say probably 30 minutes later, there I was laying in my bed in my room. My roommate, I think, hadn't come in yet. And there was sort of just this bombardment of people that came in and out of the room to do sort of just the normal admission things. We talked about if I had a DNR and who to call.
You ought to say what that, some of our listeners don't know what that is.
I apologize.
It's okay.
It's a do not resuscitate order. So if my heart stopped beating, did I want them to take any measures to save my life or sort of just let the natural course of things happen to me? I was asked about my diet. I was asked about sort of religious beliefs and if it played an important part in my life. And, we talked about insurance and, just all of these things, all these people coming in. And I can remember sitting there after about 3 hours and I was like, wow, like this is so intense. And, I came in, I hadn't just, usually patients are admitted to nursing homes from hospitals and, they aren't feeling very well and there may be some confusion and there's family around. Like, I didn't have to deal with any of those things, and still I was, overwhelmed.
Wow, that's real. I'm just gonna interrupt you for a minute and come back because we have a hospice chaplain on the line. Sue from St. Louis, Missouri. Welcome to Dr. Radio, Sirius 114 and XM 119.
Good morning.
Good morning.
I want to salute you, Dr. Bernstein, for your very innovative program.
Well, I'd love to take credit, but it really belongs to Dr. Gugliucci. But
Oh, okay. Well, I salute Dr. Gugliucci then. And I would like to say that here in St. Louis, we do a similar thing. Our medical director is affiliated with one of the medical schools here in St. Louis, and he has the students come and spend time with our hospice chaplain or our social worker or a massage therapist. And a lot of these students have never been in nursing homes or have had very limited experience with nursing homes, and they're going out with professionals that are not necessarily the medical side of it, but more the social, emotional, and spiritual side of it. And it's been a very great thing to participate in that educational piece for medical students, and it's been an education for me as well. And I just wanted to say, I think you're doing a fabulous thing. I'm going to tell the medical director about it, and perhaps there will be collaboration down the line.
Wonderful.
Well, that's really terrific. I'm curious, Sue, what you think. I mean, I agree with you. I think it's really great that the students get to go with non-MDs because I think it helps them be more, see themselves as more a part of the total healthcare team. But what do you think about this idea of having someone actually be as a patient or a resident?
I think it's fabulous.
Yeah.
And I want to say that, I go into nursing homes on a daily basis, and I am picturing myself eating pureed food and going, oh my goodness, I would have a whole other understanding of what the day-to-day life of the people that I interact with is. And I also was wondering if, you were kind of talking about some of the assumptions that people, myself included, make about folks that live in nursing homes. And I was wondering if a good part of the education isn't just to see how the people around you interact with you and the assumptions they make when you're in a nursing home.
That's a great question. Vicki, can you take that on?
Yes, certainly. It was very interesting in my situation because when I went into the nursing home, only my roommate and her family and the staff that was directly in charge of my care knew that I was a medical student. So the rest of the residents didn't know, their families didn't know, even some of the staff didn't know. So throughout the week, especially from other patients' families, a lot of the residents there never even questioned what I was doing there. They just assumed that I had become a resident just like them, and I was sort of just welcomed into the culture. But the way that some families and even some staff sort of reacted to me is the tone of voice that they would use when they would speak to me was sort of like I had reverted back to when I was 5.
So they treated you like you were a child.
Exactly. And, when I would respond back in sort of a normal tone and, with a smile or something like that, the fact that I was actually able to articulate, a complete thought, their eyes sort of just opened up and they were like, oh my goodness, what, she can respond. So I found that very striking from my perspective.
What condition were you assigned? I mean, what were you supposed to have?
Yep, I was assigned the diagnosis that Dr. G had mentioned before. I had congestive heart failure, chronic obstructive pulmonary disease. I was confined to a wheelchair for all 10 days. I had a nasal cannula, the oxygen tube around my face, or around my nose at all times. And then I did also have an oxygen tank on the back of my chair. However, the two were not hooked up. And for the first, I want to say 3 or 4 days, I was placed on what was called a 1 assist, meaning that I was unable to transfer myself out of my chair to the bathroom. I was not able to get myself from my wheelchair to the bed. and somebody was basically just responsible for all of my care. I really could not do anything for myself besides I was able to feed myself.
How easy was that for you to do?
It was
to assume that you couldn't do any of those things.
It was so difficult.
I imagine.
It was such an incredible experience. I mean, to go from, again, I walked in those doors. I drove myself there, and to go to immediately not be able to do anything for yourself. I had never experienced anything like that before, and I can tell you the loss of independence, the emotions that come with that. I mean, there's a certain level of humiliation that goes with having to ask somebody to bring you to the bathroom and to help you bathe and to do all of those things. So they're very, very real emotions.
What do you think you took away from it that you didn't have before you went?
I think, again, just from what I was just speaking about, the feeling, the loss of control and the loss of independence, what that feels like. The other thing that I left with from spending all the time that I did with the other residents is a recognition of still the individuality that exists amongst people, no matter how old they are. I don't think that you can sort of categorize a group and say, well, this is what older adults like, and this is what they want to do, and these are the activities they want to take part in, because everybody is still so individual.
Well, that's a really important lesson. Mm-hmm. What things did you notice that could have been improved upon or better in terms of the medical care that you received when you were there?
To be honest, again, because my knowledge of nursing home care is so limited, I really wasn't there to sort of critique the care that was given. I was there, at least for myself, more to just experience the emotional side of it. So I don't even know if I'd be able to give sort of an accurate account in terms of the care.
Well, what did you interact with any doctors?
I did not. My main interaction, and something that I was so struck with leaving there, was with nurses and the certified nursing assistants, the CNAs, because they are the ones that do all of the work there. Depending on, the CNA basically has control over...
A CNA stands for...
I think it's certified nursing assistant.
Okay, good.
Correct.
Okay.
Yep. They have control over sort of the kind of day that you will have. They get you up in the morning and they get you dressed, and it can either be in silence or they can talk to you and interact with you, and they do so much work at these facilities, and the work that they do, it has to be nothing but a labor of love.
Wow, that's really fascinating. For those of you out there who recently joined us, I just want to let you know I'm Dr. Carol Bernstein. I'm an associate professor of psychiatry here at the NYU School of Medicine. And we've been talking with Dr. Marilyn Gugliucci, who's the director of Geriatric Education and Research at the College of Osteopathic Medicine at the University of New England in Biddeford, Maine, and with Vicki Johnson, who is a medical student who lived in a nursing home for 10 days. Dr. G had created a program called the Learning by Living Project that Vicki participated in. And we'd love to hear from those of you out there who have elder relatives or friends who have concerns about nursing homes. We'd also like to hear your thoughts about what you think of this program to help young medical students gain an appreciation of life as an older patient. You can reach us at 1-877-NYU-DOCS. That's 1-877-698-3627. Marilyn, I want to switch gears just for a little minute. We'll come back to Vicki. I mean, it's just so fascinating to listen to her describe her experience. But what have you been able to determine? I know the number of students who've participated actually is quite small so far, but have you been able to evaluate what impact this type of program has had on the students and whether it could serve as a model for other types of experiences that might change how we educate our new doctors?
Yes, I believe I can speak to that, even though there has only been 10 students. It has been since 2005. I have followed those students each year as they go through medical school and then into their residencies to see if the learning has still remained with them, and in all cases it has. And Carol, if it's all right with you, I'm just going to back up a little bit and just say that this is what's called qualitative ethnographic biographic research.
Right.
And ethnography is basically the student is the researcher, and a culture is observed from the researcher's perspective. So the researcher is the student as she or he lives in an environment, and that's a nursing home. From that, they have to write copious qualitative notes, subjective, objective. So it's not uncommon for a student to be done after 10 days, 2 weeks, to have 50 to 70 pages of notes, all on their observations. That is actually the data for this project. Mm-hmm. Prior to those notes, they actually do something that you mentioned before. They have to write their assumptions about anything about nursing homes or about older adults. And I say to the students, let it rip. Whatever your beliefs are about nursing homes or students, let's get those assumptions down on paper so you can be conscious of those. And then as you're living in the nursing home, you can determine, were your assumptions correct or weren't they? So then, as they go along, in every case, 100% of the cases, I know it's only 10, but, we're starting, the assumptions were disproved because they lived in the nursing home, and they have been able to maintain some really critical learning pieces and have applied those in their practice. And I don't know, when you want me to mention those, but I can at any time.
Well, great. Well, Vicki, can you tell us what your assumptions were when you started?
I think, I'll be honest, I haven't actually looked back from the notes that I took when I was there. I haven't revisited those, nor my assumptions, but I can remember walking in or getting ready to go in, and I think I assumed that I was just going to be incredibly lonely and depressed after the end of those 10 days. And I think I worried about sort of being accepted into, the society there, and whether I would sort of be viewed as the other and not really allowed to interact with a lot of the residents. And I can tell you that certainly, I did experience some loneliness when I was at the nursing home, but I was so shocked at just how much time and how much joy I got out of by just sitting and interacting with residents. We talked about, the full gamut of life and death and everything in between. Like, I really forged some strong friendships when I was there, and that for me was incredibly shocking.
Oh, wow, that's quite amazing.
I do have some of Vicki's assumptions here.
Well, do you want to share those with us?
Sure. Older adults in nursing homes are sad and lonely, which she talked about. Yeah. The food in nursing homes is terrible, so maybe she can speak to
That's probably true, right?
Older adults who live in nursing homes create their own kind of community that includes leaders, followers, and other forms of social rankings.
Did you see that, Vicki?
Yes, I did.
Okay.
I did. There were not only socially, there was sort of, the social butterfly of the group, and, the welcomer who immediately came up to me and started talking to me when I was there, but there is also sort of a governing structure that exists as well. There is that meets with sort of the administrators per floor. I think there is maybe a president of the floor, or some sort of, governmental structure that exists within the nursing home. That I was tried to be recruited for. They were looking for some fresh blood.
I didn't mean to cut you off, Marilyn. Go on.
Well, Carol, it's interesting because, when you think about it, when you look at yourself and you think about yourself, do you think you really be any different when you're in a different environment or just because you're older? Usually our personality carries through and we bring those skills and ways of being with us regardless. So why not have those things happen in a nursing home? The last one here is older adults do not want to go into a nursing home, but do so because they feel that they are being burdensome to their families if they do not.
And that one, Vicki?
That one, from talking to a lot of other residents, that one sort of it is true. We all sort of accepted that this is now where we were living. But when they would talk to me about home, it was not at the nursing home. It was out with their families, and I think in the grand, amongst most of them, they really did just want to go home.
Right. I'm going to ask a sort of dicey question, but had you made friends with anyone who died while you were in the nursing home?
No, certainly not while I was there. And as far as I know, I spoke to one of the nurses recently, and they're still doing well there.
And have you gone back to visit the patients that you saw?
I actually have not gone back yet. I do have plans to, and I do have several people who have now made their way onto my Christmas card list.
But by the way, just a curiosity question, when you finished there, did you reveal that you had been a student and you weren't ill at the end?
I did not. My friends, the ones who I plan on keeping in contact with, they did know. There was a wife or a woman that was in the nursing home and her husband who came in every day, and we became very friendly. And they did know that I was just a medical student. So they knew, but most of the other residents, again, they never even asked. And after I was officially discharged, I went back up to say goodbye to the staff, and nobody even looked twice when they saw me standing and walking.
Well, they may have not noticed that it was you.
Right, exactly.
I think. Well, listen, I want to thank you so much, Vicki. We're going to take a short break, and then we're going to return and speak some more with Dr. Marilyn Gugliucci, who's the Director of Geriatric Education and Research in the Geriatrics Department at the College of Osteopathic Medicine at the University of New England in Biddeford, Maine. Dr. G has created the Learning by Living project, and I want to thank Vicki Johnson, who's been with us for this half hour as a medical student who lived in a nursing home for 10 days.